The Medicines Information Centre is a unit that has been functioning out of the Division of Clinical Pharmacology since 1980. It was initially started as a drug safety centre and then evolved into a Medicines Information Centre, and it basically provides free medicines information to all healthcare workers across the country. And so we started a national HIV and TB hotline, which became quite popular and has done well, and we've done more than 44,000 queries since starting in 2008 until the end of December last year. So we provide information to both the public and the private sector. With the HIV and TB hotline, most of our calls do come from the public sector. We started the service when healthcare workers actually knew very little about antiretrovirals, because the program had just started. Many healthcare workers who were treating patients had never been taught at university how to treat an HIV patient, knew very little about antiretrovirals. So it's been an interesting journey from, sort of having very regular calls from a doctor who needed help to them actually becoming experts and phoning very little. There's a huge lack of resources. They often don't have access to the medicines that we ideally would want to give the patient, so we often have to make do and find an alternative for them. I think they're just huge challenges in general in the public sector healthcare system in South Africa that everybody's aware of, and we're hoping that by giving this sort of assistance we can make a difference. We got offered some additional funding from our funder. They had, I think maybe because of the exchange rate, landed up with a little bit of extra money, and they offered it to us, and we decided that we were going to start developing an app. So it's got a nice tool where you can check for drug interactions. You can put in your 3 antiretrovirals that your patient is on, and you pick the other drug that they're on and click a button, and then everything will come up. It will tell you whether there's an interaction or not, and if there is, how you manage it. We've also very recently added a very nice tool on how to deal with the main adverse drug events that we see in patients on antiretrovirals and TB meds. So it covers rash, liver injury and kidney injury, and it's actually, you click yes, no, and it then takes you down the path of how exactly you need to manage those patients. It's just very rewarding to run the service, because a lot of times the healthcare worker is stuck out in the middle of nowhere with no support, and they phone us, and you can actually just feel the relief and the sort of gratefulness on the other side of the phone when you've helped them and given them an answer.